It's great to have you all with us. We are together for another case discussion series. I'm Dr. Mandana Donahue from Oral Pathology 360, the place where we bring you and everything and everyone who matters and who is involved in oral diagnosis, oral pathology, basically the diagnosis of oral diseases together. So if this is your first time here, you can hit the subscribe and we can continue with our session. So, right. Among the case discussion series, we have had many more already on the channel. So, if you want to go and watch them, there are now over 27 videos there, and you can just watch them in a playlist that is called case discussion. So, you can just see that. Another thing, of course, is that you can help with the running of this whole setup by contributing in a number of ways. You can actually contribute financially, that will help us with all the costs involved, or you can also help even just by ensuring that the content is well distributed, well shared, well watched. So you can like, subscribe, share, comment, and all of that also will help. Now, coming to today's session. Today's session is on connecting the dots by Dr. Yamuna Devi. Now, Dr. Yamuna Devi is, I'm very happy to say, was one of my students. Today, she is professor in the Department of Oral and Maxillofacial Pathology at Dhanalakshmi Srinivasan Dental College in Tamil Nadu. She has been an absolute star academically. She got the university rank while doing her masters, and she's continued a lot in academics. And even now, she's continuing a PhD, which is on oral manifestations of diabetes mellitus. Many of you may have read her paper, which was about the effects of diabetes on the oral structures and on the dentition. Now, she is really very good at what she does, and one of those people I'm very, very proud to say was my student, even though I must say I've had nothing to do with how good she is. But well, it's always great to have her with us. And let me bring her also with us here. Hi, Yamuna.
Hello, ma'am. Warm greetings, everyone. And I'm very happy to meet everyone in this lightful days of Diwali, along with on behalf of Oral Pathology 360 degrees. And I'm extremely happy to be introduced to have this great introduction by my own teacher and my one of my best teachers. Thank you, ma'am, for the warm introduction. Extremely happy for at this moment. And hi, everyone.
Thank you so much, Yamuna. Yes, it's great to have you also here. And
Yes, ma'am.
yes, I have to wish everybody a happy Deepavali. I hope the Festival of Lights brings you lights today and every day in your life, and you have a blessed life. And with that, let's begin. So, to avoid a situation like we had last week, Yamuna has been kind enough. She has sent us a video of the presentation. So, we'll watch the video together and then we will have the discussion. So please remember to type your questions in the chat and we shall get back to them. Okay.
A pleasant morning, everyone. It's a great opportunity to meet all of you through this forum. And in this session, I would like to come up with few case reports that has inculcated important learning points upon me. Hope it will be fruitful for all of us. And I myself, Dr. A. Yamuna, professor in the Department of Oral Pathology and Microbiology. The first case report speaks about imprint cytology, where I was invited to an OT for a surgical pathology procedure. The patient was a 55 years old female who has parotid swelling on the right side. She has systemic complications of kidney failure and was under dialysis. Incisional biopsy was not done, as one school of thought directs the surgeons that if it is malignant, it may spread through the parotid fascia. FNAC done already yielded only squamous cells and it was inconclusive. I was called to declare if the lesion is benign or malignant intraoperatively, and if it is malignant, the surgeon would do radical neck dissection, preventing one more surgical burden for this medically compromised person. I was provided with the surgical specimens shown Above and on macroscopic examination of the surgical specimen, there was a breach in the capsule, and the imprint cytology was performed by thoroughly washing the specimen with the saline, and the cut section of the specimen was still made into two more small pieces, and it was pressed against the slide and fixed with airspray fixative and was stained with the rapid path stain. The rapid path stained section shows sheets of hyperchromatic cells, that is intermediate cells admixed with squamous cells. The squamous cells, it may which are epidermoid cells, and they were arranged in few cystic spaces. One or more mucous cells was also seen. On the basis of macroscopic examination and the imprint cytology results, malignant salivary gland lesion was given as the report with the DD of high-grade mucoepidermoid carcinoma. The whole procedure took 15 to 25 minutes and the radical neck dissection was done. The other interesting factors observed were the picture of blood vessels that was quite different from what we see in our regular processed specimens. More RBCs were seen in the periphery, and the process of diapedesis by which the WBCs move through the basement membrane was clearly depicted. Chronic kidney disease patients on dialysis is common to have anemia due to lack of erythropoietin and is also clearly seen on the imprint cytology picture. The imprint cytology is a simple intraoperative technique that is showing promising results. It can be developed as an individual branch in oral pathology like FNAC. The histopathological picture after imprint cytology is quite different from what we see in regular processed tissue specimen or FNAC or cytology, and we need references to take this branch forward, like how a muscle look or how a nerve look, etc. Thus, it awaits the opening among the oral pathologists. In the next section, the case reports speak about the importance of hematological investigations and biochemical analysis during diagnosis of oral lesions. A 38-year-old female patient reported to the dentist with the clinical presentation of numerous petechiae and purpuras on the upper and lower labial mucosa, tongue, ranging in size from 0.5 mm to 2.5 centimeters in larger dimensions. Also, there was a continuous fresh oozing of the blood from the gums, which is the most scary part. History reveals she is a mother of two, thereby ruling out the possibility of hemophilia and other blood-related disorders. Basic complete blood examination was done, which showed her platelet count was about 5,000 cells per cubic millimeter. WHO recommends platelet transfusion when the count reaches 10,000 cells, and she was immediately hospitalized for transfusion. On further investigations, she was found to be dengue positive. The most important thing to note in her case is that she said no history of fever or any other prodromal signs and symptoms. She is a day-to-day laborer and have taken the body pain and mild fever as part and parcel of her usual work-related things. The other thing to note is that she has initially approached a general physician, and because of the presence of exclusive oral related signs, the general physician has referred her to a dentist. Thus, from this case, the most learned things are that we should never underestimate the basic investigations. If she is not transfused with platelets for 1 or 2 more days, it is definitely going to be a life-threatening condition to her. And also, we should always consider the most common disease of occurrence in that contemporary time period as one of the differential diagnoses. The third case is about a 38 years old male patient who had the chief complaint of increased thickness of tongue and roughness on either side of buccal mucosa. On clinical examination, there was mild, white, non-scrapable, indiscrete white patches along the line of occlusion, also above and below it. It was extending from the angle of the mouth to the retromolar region. And on palpation, the labial mucosa and on either side of the buccal mucosa was thickened. They were rough in texture with reduced flexibility. The patient was also systematically showing obesity in middle third part, and the examination of the part of the white non-scrubbable lesions were taken for candidal infection examination, and it turned to be negative. Then the whole body hematological and serological investigations were performed, which showed the following results of normal ESR, thereby ruling out infection. His thyroid hormone levels were normal. His calcium was slightly increased. His cholesterol and triglycerides level were increased. Also, liver-related enzymes, namely SGOT, SGPT, alkaline phosphatase, GGT, were increased in this patient. Also, vitamin D was deficient in this patient. Other hormones were under normal, and his diabetic condition was also, and he was not a diabetic patient, and his blood glucose was under normal condition. Thus, with these hematological investigations, there was a rise in the liver related enzymes, cholesterol level and triglycerides level, calcium level, whereas the vitamin D level was decreased or it was deficient. The patient was referred to a gastroenterologist and was diagnosed with non-alcoholic fatty liver. At this junction, I would like to speak upon the increasing incidence of vitamin D deficiency, especially among the female patients. We are spending more our times indoor, thereby having reduced exposure to sunlight, resulting in vitamin D deficiency. Vitamin D is converted into the primary form, the liver, and biologically active form in the kidney. So patients with liver disorders and kidney diseases are more likely to have vitamin D deficiency. And we know very much that vitamin D is highly connected with bone metabolism. It is also essential for the proper functioning of the cardiac muscles and for the maintain healthy gut microbiome, for the protection of blood vessels, for muscle functions, for strengthening of the immune system. It reduces body inflammation and it also helps in the insulin production. Thus, vitamin D deficiency is connected with infections, diabetes mellitus, autoimmune disorders, skin diseases, bone disorders, muscle weakness, mood swings, and depressions, especially in the females. In oral related lesions like autoimmune disorders, skin allergies, infections, diabetes mellitus related oral lesions, vitamin D evaluation can be done, and increased sun exposure improves the overall body health of these patients. Hope the audience are not drained. And our next section of this session speaks about the oral manifestations of the systemic disorders. In the case report, a 58 years old female patient, she was presenting with ulcers and related pain and burning sensation as the chief complaint. She added that the ulcers are occurring frequently and at varying times at different sites like the lips, tips of the tongue, etc. On examination, the ulcers are of varying sizes from 0.5 to 1 centimeter in greater dimension, and the floor was covered with white slough with red hollow borders. The recurrent after ulcers was considered and medications were given. On her later follow-ups, the ulcers were healed, previous ulcers were healed, and new ulcers were present at other sites of the tongue with similar clinical presentation. They were affecting the quality of her life, and her frequency of occurrence of such ulcers were from more than 6 to 8 times per year. The biopsy was taken from 2 of the ulcer sites and sent for histopathological examination, and the histopathology was non-specific. And to rule out Behçet's disorder, on systemic, we have done the systemic examination, and she said that she was already operated for cataract in her left eye, and she was also having varicose veins. Behçet syndrome was confirmed according to the international criteria for Behçet's disease, where she has the occurrence of recurrent oral ulcers more than 5 to 6 times per year, and she was also having ocular lesions and vascular lesions. Similarly, one another 33-year-old male patient had recurrent after stomatitis occurring nearly more than 10 to 15 times per year, and his histopathological examination of the oral ulcer was non-specific. He has conjunctivitis as oral ocular manifestations, and on examination of his palatal ulcer by the gastroenterologist, his palatal ulcers were positive for the H. pylori infection. H. pylori infection positivity is more common in Behçet syndrome, and while treating the oral ulcers of these patients, they should be treated for H. pylori infection also by collaborating with the gastroenterologist. Serologically, we can confirm the Behçet syndrome by HLA-B5 antigen presence. While treating these patients along with the topical steroids or immunosuppressants, vitamin supplements, we should also focus on the lifestyle modification factors, which forms the main and most important part of this treatment plan. Next is the presentation of the oral ulcers in a 28-year-old male patient. He is diagnosed with rheumatoid arthritis during first visit to me, and he was complaining of burning sensation on the palate. On examination, minute papules were seen on the posterior part of the palate, and on his next visit after 2 weeks, these minute papules coalesce into small bullous lesion with white surface. The oral ulcers are common in rheumatoid arthritis patient also due to the following factors: because of the disease and its course, and because of the interaction of the drug that was taken as a medication, especially methotrexate. So during the treatment of the oral ulcers in the rheumatoid arthritis patients, folic acid supplementation can also help, and definitely lifestyle modifications to be reinforced for this patient. Next is a series of case series of lichen planus. There's no difficulty in diagnosis. Bilateral white non-scrapable striae are easily identified, and the most common observations in lichen planus patients in my clinical practice is listed below. There is an increase in the prevalence rate, especially in females after 45 years of age. And the most important thing to note is that the younger age groups less than 30 years are also coming up with lichen planus. These lesions are more commonly associated with diabetes mellitus, and more stress-related factors are ruled out during the history. Along with regular medications, lifestyle factors evaluation and modification counseling becomes mandatory for these lichen planus patients also. Importance of lifestyle modification has been spoken out in all the oral related lesions of autoimmune diseases like recurrent rheumatoid arthritis, lichen planus, and even in Behçet syndrome. It is on the basis of the following 5 components which has achieved greater dimensions and scientific support in the last 2 decades, namely epigenetics, inflammation, gut dysbiosis, functional medicine, and stress. Health has 3 important components, namely physical, mental, and social component. In treating oral lesions of lichen planus or recurrent after ulcer, rheumatoid arthritis, or Behçet syndrome, we are treating only a part of the physical aspect, that too the components of signs and symptoms. All the 3 components are interrelated, and we cannot prevent recurrence by treating only physical symptoms and signs. Stress is broadly classified into acute and chronic stress, and the mechanisms by which body reacts in acute and chronic stress is quite different. The concept of stress and its day-to-day management is gaining attention in Western countries and applied even in the treatment of gingivitis and periodontitis. All stress-related factors should be evaluated in the oral lesions of autoimmune disorders and Behçet syndrome, and also should be counseled or eliminated for the better treatment outcome. Inflammation forms the basis for many immunometabolic disorders like diabetes, heart disease, etc. There is an induction of chronic, low-grade sterile inflammation in the body termed as metaflammation, which is common in these immunometabolic disorders. The main causative factors for this metaflammation or the inflammation is the gut dysbiosis or the leaky gut or the oral gut liver axis. When the healthy gut microbes are replaced by unhealthy ones due to inappropriate food and food habits, the gut becomes leaky, and these unhealthy microbes induce metaflammation throughout the body. Thus, gut microbes are closely related with skin and autoimmune disorders, and diet factors of patients should be evaluated and counseled. As we discussed earlier, vitamin D deficiency can induce metaflammation, and also a modern sedentary lifestyle like lack of exercise or lack of physical activity over nutrition can also induce this inflammation and metaflammation. The inflammation inducing factors should be analyzed and in each and every patient individually and replaced with healthy lifestyle factors for a better outcome of in these oral lesions. Epigenetics is one another promising factor which says gene does not behave like a stone. Epigenetic modifications can increase or decrease the expression of a gene to any degree. For example, it promises us that even if a person is genetically prone for a disease, through healthy environmental factors, these epigenetic changes can delay or prevent the disease occurrence. On the contrary, unhealthy lifestyle in these patients can help in their early clinical disease manifestations. Also, a person who is genetically free from a disease, through unhealthy environmental factors, he becomes prey for the disease. Thus, epigenetics is a double-edged sword and can be transferred from one generation to the other generation. With the knowledge of these signs, the reinforcement of regular rhythmic healthy lifestyles in these patients can be definitely beneficial, preventing the recurrence over a period of time. These lifestyle modifications mainly which again we need to incorporate is that rhythmicity in their day-to-day lifestyle, that is rising along with the sun and going bed after sunset, their proper diet evaluation and counseling, thereby preventing the gut dysbiosis and related inflammatory changes. Their sleep pattern should be proper, avoiding the usage of gadgets after the sunset especially, thereby increasing the revival mechanisms and related decreasing the oxidative stress that occurs during the proper sleep. We also should rule out the proper psychosomatic disorders in these patients. Exercise and exposure to sunlight increases their vitamin D naturally. Appropriate usage of gadgets, especially their rational usage, should be reinforced to them. Thus, their physical, mental, and social health should be reassured. Thereby, they can completely have a greater change in their lifestyle modification. Now we have a question. Doc, a simple referral can do, and why should I interfere in other specialty? This is because many systemic diseases have only oral manifestations at the time of patient's visit to a dentist. Referral or delay in diagnosis can cause delay in this disease intervention. At times, patient may not go to the referred doctor for many reasons, especially for economical reasons. Also, the same patient can have multiple dentist visits for the same issue. And early diagnosis and early prevention can be life-saving at times also, as we see in the case of a dengue patient. And the treating the disease rather than symptoms becomes possible with the complete knowledge, and wholesome treatment can be provided, preventing or delaying the recurrence. Thus, I like to conclude that we are in a phase where we need to step forward by collaborating with other medical specialties like gastroenterology, neurology, etc., to give the patient a wholesome treatment. Also, empowering our knowledge and reviving ourselves with revised curriculum becomes the vital need. Thus, by connecting the dots, we can wear the correct spectacle to view the disease and its course, that by treating not only the symptoms but the disease by itself. I also convey my heartfelt gratitude to my parent institute during post-graduation College of Dental Sciences, Davangere, Dr. Madhumam, who is the head of the department by now, Dr. Mohan sir for teaching us the imprint cytology, Dr. Praveen sir, Dr. Priya ma'am, Dr. Ashwini ma'am, and also Dr. Mandana ma'am, who is the head of the department then, Dr. Nandini ma'am, who was my guide then during my post-graduation. I also extend my heartfelt gratitude to Dr. Pradibha Ramani, who is guiding me with my cases even now, and my clinicians, Dr. Uma Shankar ma'am, sir, and Dr. Shamla ma'am, the maxillofacial surgeon, Dr. Mahendra Pirmal, for supporting me with their cases, and also my working institution Vivekananda Dental College and at present Dhanlakshmi Srinivasa Dental College for their warm support and help always. I also love to have open discussion with the faculties all over the world as to any updates or what methods already followed. Thanking one and all for your patient listening. A pleasant morning, everyone. It's a great opportunity to meet all of you through this forum. And in this session, I would like to come up with few case reports that has inculcated.
So we are open for questions. Right. Any questions, any suggestions, any thoughts? Now we can take those. And let me see if everything is fine. Yeah, it seems fine. Okay. Right. So today we have with us Dr. Kirti, Dr. Nasser, Dr. Madhu. Yes. So Madhu ma'am is here to hear you. Okay.
Hi, ma'am.
Right. Any thoughts or questions on the topic? Yeah, I think Dr. Nasser has a question. Right. Any of the lichenoid lesions had history of betel nut use?
So, actually, lichenoid reactions most probably they are connected with amalgam restorations, as per I have seen. And in those patients, as we go, as usual, we will be removing these for those alkaloid amalgam restorations and will be replacing with the recent ones. And I have not yet seen with the no, even lichen planus is not even associated with betel nuts. So far as I have seen.
Correct. Okay. And anything else? I think today, at least on this half of the world, everyone is in the celebratory mode, I guess.
Yes.
And okay. Uh, Before that, Dr. Nasser had said very nice presentation and cases.
Thank you.
Thank you, Dr. Nasser. And of course, Madhu had said hi. Dr. Nasser had said hi. And Dr. Kirti said, yes, you're most welcome and thank you for attending. So, okay, let's give it a minute more and then see what else comes along. So, you were telling me about the success you have got in controlling a lot of the lichen planus through just diet and counseling. What gave you that idea?
Actually, ma'am, the as I said, the even the youngsters are coming up with lichen planus, ma'am. And when we are evaluating their stress factors, they use one term, learned helplessness. Like that way, through the use of gadgets and through modern excessive usage, ma'am, they are stressing themselves, avoiding the social communication, even with minor problems, or they are not even having a healthy lifestyles like proper diet. They are negotiating every other thing, and they are definitely following an irregular lifestyle, ma'am, that is causing so much stress. Three of my patients are younger than 25 years, and one of them accepts that he's over usage of gadget, and he's having so many stresses. Even his mental stress he's not even sharing with his colleagues those things. And the occurrence of lichen planus in such younger patients is definitely a very worrisome one, ma'am. So that's what's the thing. I thought what is important should be learned. Then that's what I have started the counseling session individually for them, ma'am. Even their diet is also not appropriate. The word rhythmic should be they are taking good proper diet, ma'am, but it is not a rhythmic one. Or at times when they feel and when they don't feel, those things are also making an important thing. They are one of the stress factors, ma'am, and they are not even knowing the importance of diet, proper sleep, and mostly their sleep will be after 11, after 12, after 2, or after 3. That's
Yes,
because
that
of
is
at
true.
times they. They used to see films or they used to have chats, and after three,
Hmm.
that's are also ruled out during the history, ma'am. That's the main thing. And this is a main platform, I thought, ruling out their history, because when we keep on giving topical anti immunosuppressants or topical steroids, and they continue with their lifestyle, it won't help either the patient or the doctor, ma'am. The disease will be keeping on increasing. So the self-realization is the main thing, especially in the treatment of autoimmune disorders, and even these Brexits, everything, I feel. Yeah. That's why I have
That is
started
very
with the
true.
council. Yes,
No, it is very, very, very true. And it's increasingly become, it's increasingly common that communication is, I mean, even we forget youngsters. I mean, I know you're much younger than me, but and now very often it's like you run out of words or the right way to express yourself and you put in an emoji, you
yes,
know.
ma'am.
So often we use emojis just because, oh, okay, what am I going to say? Let's put an emoji. So it's like that, you know. And there's
Yes,
so much, but it takes away so much of the normal conversation and the normal interaction. And at the same time, I think a lot of the times we also get very carried away, you know. This You have a message that, you know, pops up on your WhatsApp in the middle of the night or last thing in the night. There is that temptation that you should respond, you know.
yes,
Or even on the many social media, and even things like LinkedIn, you get a message or you get something, you get that feeling that you need to respond. So, and it actually takes discipline to say no, I'm going to wait till my working time. Tomorrow the world is not,
yes,
nothing is going to
ma'am.
change, you know.
Yes,
But
ma'am.
it takes, yeah. And also sometimes you forget that it's late. I mean, it has
Yes,
happened to me. I've just sort of, I'm checking to see if I have any message from family, you know, or anyone, you know, a non-work related, just before going to sleep. And then there is something that's work related. And I literally forget that, oh, okay, I should not be responding to this in the middle of the night.
yes,
You
ma'am.
know? So it's like,
Yes, ma'am.
yeah, it happens. It really happens. It's become more and more difficult to draw those lines between work, between, you know, social life, personal life, work life.
Personal
It's
life.
becoming very
Yes,
difficult.
ma'am.
Yeah. Let's see, we have something here. Dr. Karuna Karan. What are the role of probiotics in after salsas?
Yes, sir, definitely it is having a great role, because probiotics, it improves the gut dysbiosis, that it helps in eliminating the dysbiosis. So that's why I also accept the role of probiotics and even prebiotics. Whatever the things that is healthy lifestyles, or even our local fruits will do. It's not that we should only go for like high end, economically high end fruits or antioxidants, whatever it is available locally. All those things, probiotics, prebiotics, increased intake of our localized fruits, like whatever available fruits, vegetables, and at proper timing, and before sunset and after sunrise, avoiding food after the sunset, those things will really help in the gut health, sir. And yes, sir, of course, while probiotics is also I'm recommending for them, and the results will be, definitely it will take time, but it has very good results. And the patients themselves will have a modified lifestyle, they will have an entire change in their skin, everything they have. Even by mental health has come up. It is definitely a burden for the dentist or any clinician, because in their excess of patient load, they cannot spend so much time. But it should be definitely a concern in their patient. They can appoint, and there are many nutritional or the people we can train also, and through them also we can give these important things. And more than medications, we should make a note to them that it should be a part of your regular lifestyle also, so that they should not be away from this. And whenever you move away, you will be again presenting with this disease is a part of you, and it is in your hands, that you should not make it to occur, recur, or control. That things should be mainly given in their minds. That's the main part. And of course, probiotics has a great role, sir, in after salsa. And in treating after salsas, we should check for Bexids and for H. pylori infection also. Because if there is H. pylori infection, we should give antibiotic course for H. pylori also. That would definitely help in easy healing of the after ulcers. Because it
Okay, I got to
really,
ask you. I'm sorry.
is,
Okay,
is
finish, then I will ask.
it is definitely going to affect their quality of life. It is with so much pain that they are coming to us. And these patients are they cannot be they are really feeling the burden of the disease. We think it is a simple aphthous, but they are having so much demerits of this simple aphthous in their whole lifestyle also. So they cannot take up a normal food, or they cannot even for a function they are thinking twice whether I can go or not because of the heavy spicy foods or those things. And even with the family wise, they're making a separate food for them, and so many things are really worrying them. And definitely with the probiotics we can help them a lot.
Okay, my question was, you mentioned prebiotics. What are prebiotics
Yes,
now?
ma'am.
Sorry, I don't know what it is.
Those
So,
ma'am, those which helps in the gut health, like a probiotics and prebiotics, which improves the gut health. We used to call them in the food items. We call it as pro and prebiotics, ma'am.
okay, fine. So it is the probiotics, I think, are the concentrated versions of things. Probably prebiotic is the normal one,
Yes, ma'am.
something like that. Okay,
Yes, ma'am.
cool. Okay. One has to learn. That's the whole purpose of this. Okay. Right. Hello, Dr. Asesina. Yes, good day. And he's just wishing us nice to have you here. And Dr. Karuna Karan also says nice presentation.
So,
Okay, we have Dr. Farnaz. Greetings. How to treat lichenoid dysplasia when there is dysplasia in lichen planus? Okay, you take that.
sir, lichenoid dysplasia, actually, it all, if there is a dysplasia, definitely we should go for a surgical thing. And dysplasia, if it is a mild to moderate or severe, according to the grade, definitely we should go for surgical help only, sir. Because once dysplasia arises, and as we see in the last session, we should also go for multiple sites for taking biopsy. And once there is an issue of dysplasia, it is definitely going for surgical help. These treatment plans will be helpful only to prevent these reticular type of lichen planus, especially not to turn into, even if a reticular type turns into an erythematous or erosious type, we should definitely go for biopsy. So many patients they present only with simple reticular type, and to maintain their integrity and not to convert into a still worse form, these treatment plan will be help. Once any erosions or any ulcerative changes arises or any dysplastic changes arises, definitely we should go for surgical help on this. We should definitely do for biopsy and see for the malignant change.
And I think one should always be able to distinguish between lichenoid dysplasia is not lichen planus at all.
Yes,
Lichenoid is lichenoid. It's just like similar to
like
lichen planus, but it is not lichen planus. So the line of treatment is that of dysplasia. It, actually, there is no lichen planus there. Now, lichen planus, although we say that it could be among the OPMDs and might turn malignant, there's a little bit of question there. But, anyways, even if we take that into account, then you need to think about it as, I guess, the fact that it needs, of course, a biopsy. Without a biopsy, you would not know that there is dysplasia in there, and then you treat. If it is definitely dysplasia in lichen planus, then I think you need both the treatments. You need to treat that dysplastic area, that lesion, and then you need to treat the lichen planus, which is a systemic condition. Now, as far as the lichen planus treatment, you can add in, but I think they would basically be two different things to be treated.
yes, once dysplasia, definitely the cancerous change should be followed up. Even during the course of these patients who are with normal reticular type, also we should definitely follow up them for any cancerous change, because at any time period they are prone for the cancerous change. And clinical examination, including palpation, should be done periodically, and regular clinical photographs also to be recorded.
Yes, that was a very good thing you had mentioned to me also. Yes. And we have Dr. Uma Shankar, who says, nice presentation as a clinician. After Dr. Yamuna visits as a consultant, my approach towards patients with oral lesions has changed. That is very nice to know, Dr. Uma Shankar.
Thank you,
Thank
sir.
you for
Sir is my
sharing that.
clinician. is believing me and providing me with cases. Thank you so much, sir. And
That is
he
what we
also
hope to
accepts my
achieve.
yes,
Sorry, go
ma'am.
ahead.
And in amidst his busy schedule, he also gives a separate schedule for the patients. And he's also so much supporting in taking up these new ideas and advances. Thank you so much, sir.
Yes, always very nice to find that sort of a support.
Yes,
Okay,
ma'am. Yes,
Dr. Nasser has said as a postscript, yeah. Okay, lichen dysplasia is diluted now in WHO 2022. You are probably dealing with dysplasia plus lichenoid changes. That is very true. Yes, quite. And okay, thank you. So I think, right, we do not have any more questions, and we are also at the end of our time. So, right, so let's move on. I shall present you with your certificate. Thank you so much for joining us.
yes.
Thank you for that lovely presentation.
Thank you, ma'am. Thank you so much, ma'am. Thank you for giving me this great opportunity and to meet all my colleagues and faculties from Dr. Karnakar sir, Dr. Umashankar sir, Madhu ma'am, and Dr. Nasser sir. Of course, I meet him through Oral Pathology 360, and of course, I don't know his face, but I often meet him through this platform. And thank you, sir, for your lovely questions and making this session live. And I thank everyone for your lovely presence and questions. And of course, definitely, and in these treatment aspects we are really coming up, and whatever suggestions kindly come up with, and we can together improve the patient's health also, and I believe in it. Thank you. Wonderful.
That
Thank you, ma'am.
is
Thank you
that
so
is
much.
true. Oh, you're most welcome. You don't have to say thanks. All your own what I would say, great work. So,
Thank you, ma'am.
thank
This
you.
seems to be simple, ma'am, but it really have a great change in patient's life when we put it.
I'm sure. Like you mentioned, at some other point, we will have a series where you can share your work on lichen planus.
Sure, ma'am.
We will
Sure.
have a session dedicated for that
Yes, ma'am.
because there seems to be a lot of interest too.
Yes,
Okay, so with that, I shall now go on and share with you all what are going to be the next events. Right. So, coming up next week, I'm going to start something called the Town Hall, where you can ask me any questions you have about Oral Pathology 360. And I can also share with you what is happening, what is new, where we are going, what we are doing. There seem to be some thoughts and some questions. So, I thought rather than, and I always feel a little bad, adding things to the lecture time because it's about something else. So, don't want to take that time here. So instead of that, I thought we will have a once a month meeting for about 20 minutes where we can just discuss about where we are going with Oral Pathology 360, and you can share your thoughts and your comments because after all, it is really for all of us. So that is one. And what has, sorry. Okay. Right. And the week after that, we have said that this is also now about oral medicine and radiology and diagnosis. So, of course, we have to have sessions dedicated for them. So, we have an interesting session on how to diagnose TMJ problems. It's all about TMJ imaging and the diagnosis sort of matrix that needs to be used. And we have someone who's going to handle that through the use of ultrasound, which is very interesting. She has done this quite a few times, and I hope you will be able to join us for that. And that is 2 weeks from now on the 8th. And with that, I'll say thank you for watching us. Thank you for being here. And I do hope to see you all soon, next week, and of course, every week after that, right? Until December, when we will take the end of December for a 2 week holiday. Okay. So take care. Have a great day. You are celebrating Diwali still. Please enjoy, and we shall catch up next week.